Hi, I'm Bill Osmolsky with the MacIver Institute, and this is your MacIver News Bulletin. Within the next couple of weeks, the Wisconsin legislature will be done for the year. After that, everyone's attention will be on the fall elections. Now, until then, lawmakers are making a final push to show Wisconsin voters whose side they're on. Right now, the focus is on rural communities, tax relief, and what to do with an extra $450 million budget surplus. Governor Tony Evers has a reputation for not caring about Wisconsin's rural communities. During his State of the State address, he finally decided to do something about that.
We have leaned on farmers and their families. We have depended on their dedication, and we relied on their resilience. We have not forgotten those who have shared the harvest and bounty, feeding our families, our communities, and our state and our country for more than a century. And tonight we say that we are ready to be a partner in the promise of posterity.
Evers wants to spend $8.5 million to hire 35 new state employees to help dairy farmers. Republicans say that's a joke.
In talking to farmers around the state, especially in our districts, and especially last week with Ag Day in the Capitol with the Farm Bureau folks, they need actual help. They don't need more government bureaucrats.
Republicans are working on their own package of bills that includes income tax credits for farmers and tax deductions for health insurance. Those bills had a public hearing on February 11th. Physician assistants could soon have more flexibility to help address the critical healthcare shortages in rural and urban Wisconsin. PAs often handle basic routine medical care, but current state law keeps them on a tight leash. PAs have to work under the direct supervision of a medical doctor, and they are only allowed to provide services that supervisor is also trained in. That means when they get a new supervisor, existing patients can be out of luck.
Since I have worked at Redcliffe, I have had seven supervising physicians. Each one offered different services based on his or her training and education. The following are examples of services that I have had to stop providing at one time or another under Med 8.07, number 1. DOT medical certification exams, therapeutic joint injections, endometrial sampling, casting and management of non-complicated bone fractures in all age groups, IUD insertions and removals, and primary care for children ages 12 and under.
A proposed change in state law would allow doctors to collaborate with PAs instead of just strictly supervising them.
And collaboration to me is just working together. It's already happening. I work at a small satellite clinic. We have 2 satellite clinics, urgent care, in a larger family practice area. I work at a smaller area. I'm the only primary care provider there full time. My CMO is a physician, and she does work there 8 hours a week with me. But I hold down the fort, as they say. Why? Because I've been trained. I went to Marquette University. I have the skills. I've been trained under the medical model and the experience to help take care of people in my community, and I'm proud of it.
The Wisconsin Medical Society opposes the bill, but there are still some doctors who openly support it.
I support the CARES Act bill because I believe PAs are the solution to primary care in our rural and underserved areas. These areas cannot support a full-time physician who typically needs to pay back enormous student loans in a healthcare system that rewards physicians financially based on production for the most part. I have noticed that PA schools emphasize treatment of underserved patient populations in their training. Another reason I support the bill is because it allows both the PA and the physician to practice at the highest level of their licensure. I value the PAs with whom I work, and I believe present regulations cause roadblocks to optimal patient care.
Both the Assembly and Senate have held public hearings on the bill. The next step is for one of those committees to take a vote on it before the full Assembly or Senate can debate it. The MacIver Institute is dedicated to covering topics that affect free market economics and individual freedom in Wisconsin and beyond. Be sure to visit www.maciverinstitute.com for regular reports, and check us out on Facebook, Twitter, and YouTube. For the MacIver Institute, I'm Bill Osmolsky, and this has been your MacIver News Bulletin.